when the economy tanks, instead of laying off people, George will tell you, something better happens than being laid off.
Thank you, John, and great to see a great turnout here today, and for people really interested in these issues and advocating very strongly, particularly for people who don't have a significant voice on their own. The bill that John was talking about was one that I worked on, took a few years to get it done. We did get it passed last year. We now have a shared work program operating in Virginia, which means that when an employer is faced with a situation where there's a temporary shortage of work for them to do, and they're faced with a situation where they need to be able to cut back on their expenses to be able to keep their business functioning well, they don't have just that option of eliminating people's jobs, laying people off for a period of time. What they can do is reduce the number of hours for a large number of employees rather than having to lay anybody off, which actually in many instances helps the businesses long term, because when the work comes back, they don't have to find new employees and train them and do everything else. It also maintains, is very effective in maintaining morale within the workforce when no one's been laid off, and it actually produces significant benefits. It gives another tool to the employer, and the employer gets to decide whether they want to lay someone off or instead of, if they have 5 employees, rather than laying one of those 5 off, to have all 5 work 4 days a week. Same amount of hours of work, same amount of work as gets done, but it provides significant benefits long term, and it is particularly helpful to those workers who then don't get laid off and lose their jobs and have to go try to find something else. It's going to have to be an evaluation done, and we're going to have to deal with it with some more legislation next year, but I am optimistic that we will be successful with that. Just to pick up on a few highlights from this year's session, there's already been a little bit of reference to the budget situation. One of the things I can tell you is Governor McAuliffe is doing a fantastic job. It has been great to work with him on a number of issues, both last year and through thus far this year. He is making a significant difference, and he was the right governor at the right time, because we faced a major problem in Virginia. Due to federal sequestration, which hit in October of 2013, there was significant impact upon Virginia. At the same time the national economy was moving forward, there were 4 states where the economy actually tanked and went down. Those 4 states were Virginia, Maryland, Washington, D.C., and Alaska. All states where a significant part of the economy is dependent upon federal spending, and particularly defense spending, which is half of the cuts under sequestration. In Virginia, it obviously affected us, particularly with the defense contracting industry in Northern Virginia, but it was not just Northern Virginia that's affected. What a lot of people in Northern Virginia don't realize is that the Hampton Roads area is more dependent upon the federal government than is Northern Virginia. And you put Northern Virginia and Hampton Roads together, that's over half the population of the entire Commonwealth of Virginia. So we took a big hit. It was the first time since they began keeping data on this that our economy had gone down while the national economy had moved forward. We've generally outperformed the national economy and done well over the last 50 or 60 years, moving from a fairly poor southern state to one of the top states economically in the country. What has been great is what's happened during this current fiscal year, which started last July. After the cuts that we had to make in our budget, and multiple cuts were made during the year last year to deal with the shortage of funds, we were cautious in terms of what we projected for this fiscal year. Projected a 3% growth in our general fund revenues. Instead, the growth thus far this fiscal year is up about 7%. What that has done is put us in a position that part of the reason there was some amity as it related to the budget this year, and the budget that Governor McAuliffe put forward, the amendments he put forward, and what the House and the Senate came up with were actually pretty close together, made it easy to get a final budget passed. And as was stated, the governor did not offer a single amendment to it, so that budget is in place and has been signed as presented by the Assembly. But what it did was allow us to restore a lot of the cuts that had been made during the past year, particularly in areas like higher education and funding for a lot of the nonprofits. Northern Virginia Family Service and another number of others in Northern Virginia had funds cut that then we were able to restore, and we did some very good things. One other thing that we were successful on this year, and there was a little bit of grumbling when we first got down there about the actions that Delegate Watts talked about that the governor had made last year during the year on Medicaid. Because of our economy improving faster than had been projected, number of people on Medicaid has been going down in Virginia, and we had funds available. So Governor McAuliffe applied it to things like the curb services to the seriously mentally ill that Delegate Watts talked about. One other thing that has been extraordinarily successful, though, that he added in there was coverage, dental service coverage for pregnant women. This has had a tremendous benefit. I do some work at a community health center down in Prince William County where there are a large number of women who come through for their prenatal care. And we also have dental service there. So now those women, while they're getting their prenatal care, they get referred into the dental service, which is actually even on the same side of the hall as the prenatal program. And the physicians and midwives who are providing the service to the pregnant women say it has made a tremendous difference to these pregnant women to be able to get that dental coverage. There was talk about trying to take that away and eliminate it from the budget, but then all of that stayed in. So there were a number of things that were very, very positive there. Just a couple other quick things. One of the things that I worked on extensively this year, I was not sure until about the last week, but I was going to get it through because there was a lot of resistance, and that was to set up a program, service requirements that will deal with the public higher education institutions when they have students where there's an indication that the student may be suicidal or is at least expressing suicidal tendencies. Partly as a result of a case from a family from Fairfax County who had a student who committed suicide at Virginia Tech after he had told a friend of his that he was going to do that, and the friend reported to the university. The university did not intervene and did not notify the parents of this situation. We now, it took us several years, and Senator Peterson worked on this issue over the last several years as well. We did get legislation through this year that was finally agreed to by the higher education institutions that says anytime there's indication of a potentially suicidal student, exhibiting suicidal tendencies that gets reported to the university will immediately notify the counseling center or the student health center. They will then contact the student and evaluate the situation, and if appropriate, they will then provide or offer to provide services, and if appropriate, will then involve the family and others to try to build a support network. A lot of young adolescents and young adults, during that time period are going through a lot of changes in their lives and a lot of changes physically at that time, and that's where the highest rates of suicide generally are. By having a program in place that will help deal with some of these college students who do have suicidal thoughts, and many of them do attempt suicide during their college careers, I think we can dramatically reduce the suicide rate on college campuses, and I think we finally have a program that's going to move forward on that. One other thing, I think Delegate Lopez talked about stupid and mean-spirited bills and things that have been proposed. I want to tell you about one of the dumbest things that Virginia ever did. A few years ago, Virginia got sucked in, and Senator Adam Emmett and I have been working on this, but I got success on it this year. One of the dumbest things Virginia ever did was buy into a proposal that said, rather than if someone has overpaid on their taxes, and when they fill out their state income tax, they're due a refund, but they really don't want to give out their bank information, so they don't put that there for a direct deposit to the bank. Historically, you got a check. But a couple of years ago, we changed the rules so you don't get a check. And instead, what you get is a debit card in the mail. And what I can tell you is there are, it saved the state about $200,000, but it cost hardworking Virginians who were due a refund tens of millions of dollars because many people couldn't figure out how to use it. Many people, finally, did things that resulted in fees being assessed to it. So the amount they got out in the end was substantially less than it was supposed to be. And after periods of time, they start sort of automatically deducting the money from it. It was disastrous for a lot of people. And among the people who were most affected by it were many elderly people who may not have had a car anymore, weren't driving, couldn't get around to be able to use this debit card, didn't quite know how to deal with it. One of the places that I heard a lot about it is a facility in my district called Green Spring, a very large continuing care retirement community, which is its own precinct, the highest voting precinct in Virginia, highest turnout precinct. And he said, a lot of people said, well, I don't even leave here. Where am I going to go to use this debit card? We had military people who got these debit cards when they were stationed somewhere in some far-flung country with absolutely no possibility of ever using these types of things. So Senator Emmett and I had both had bills in the last couple of years, and this year we finally got it taken care of. If you are due a refund this year and you don't put down your bank account information, you will get a debit card, but this is the last time that will ever happen. Next year that will be taken care of and you get it back. So, with that, thank you very much, and we will answer questions later. Thanks.
I'd just like to point out on the shared work that it saved 30,000 jobs in the state of Washington. And Washington is very mirrors Virginia in terms of workforce, so it could be very significant. And also, optional for the employers. They don't have to participate in it. I'd like to call